As medical experts try to slow the surge, they're also learning more about the effects of the virus. So we know symptoms can linger for weeks, even for the healthiest of people. Brooke Katz has been looking into this for us tonight. She's got the new details in studio. Brooke?
Well, Doug, so many previous studies have focused on people who've been hospitalized with a severe case, but this one tracked outpatients, and it found as many as 1 in 5 previously healthy young adults were not back to their usual health even after 14 to 21 days.
This is a new disease for all of mankind that we know that's only 6 months old. So there's still a lot we have to learn.
Each day seems to bring us new information about COVID-19. We talk with Dr. Diana Cervantes, an epidemiologist with UNT Health Science Center, about the new CDC study. Researchers surveyed 292 people who tested positive and were treated as outpatients. While 65% reported they'd healed up after about 7 days, 35% said they had not.
There are reports now that are coming out about those types of symptoms and those types of patients where it's not just, I feel terrible for a week, it went away, and now I'm back to normal. No, it's I felt terrible for a week, and then I very slowly recovered. And then even after recovering, maybe the fever comes back, maybe some signs and symptoms can even come back.
And she says to keep in mind, just because you're not hospitalized doesn't mean there's not a significant impact. Even the researchers pointed out these lingering effects can lead to more missed work, studies, or other activities. And if you're wondering how the numbers compare to the flu, the researchers say 90% of outpatients will recover within 2 weeks of a positive flu test.
You have to think most of us have been exposed one way or other, if not because we've gotten it from natural infection, but because of that vaccine. That recovery is going to be a lot quicker because we have some kind of immunity.
And Dr. Cervantes says this really does show that we need more studies on the impacts of COVID-19 on larger groups of people. And the researchers say these sorts of findings are key to understanding the full effects of COVID, especially in those milder cases. Doug?